Imagine relying on a smartphone app to kick your addiction to the curb, only to discover it's peddling unproven advice that could derail your recovery. It's a scary reality in today's digital health world, and experts are sounding the alarm. Let's dive into why unregulated mobile health apps and AI tools promising to help with substance use are causing such concern, and what you can do to navigate this tricky terrain. In a thought-provoking commentary featured in the Journal of the American Medical Association, a team of researchers from Rutgers Health, Harvard University, and the University of Pittsburgh sheds light on the growing influence of unchecked mobile health applications and generative artificial intelligence, AI, tools. These technologies claim to support people in reducing substance use, but without proper guardrails, they might do more harm than good. Leading the charge is John Patrick Allen, an esteemed member of the Rutgers Institute for Nicotine and Tobacco Studies and an associate professor at the Rutgers School of Public Health. As the senior author of this piece, Allen emphasizes the urgent call for enhanced supervision over emerging technologies like these apps and AI systems. He argues that public app stores and marketplaces desperately need stronger guidelines to ensure these tools are safe and reliable. Picture this: apps flooding your phone's screen with flashy promises, but lacking the backing to deliver. Allen believes more openness about how these apps work, combined with tougher rules, could protect users from falling for content that's dressed up as trustworthy health advice but isn't. So, what's the real problem with mobile health apps aimed at cutting down on substance use, like those targeting alcohol or tobacco habits? Studies in controlled environments suggest that certain apps can indeed assist folks in scaling back their substance intake, for example, by tracking habits or offering motivational tips. However, when you take them out into everyday life, their effectiveness often fizzles out. Why? Well, app stores tend to spotlight those that rake in money through advertisements, sidelining the ones grounded in solid science. This means the apps that catch your eye might be unproven or even deceptive, all because profit trumps evidence. Consequently, it's tough to stumble upon truly research-backed options. In-depth reviews of these apps reveal a stark pattern. The majority skip established, proven strategies. Instead, they hype up their benefits with over-the-top assertions and jargon that mimics scientific credibility, fooling users into thinking they're getting expert help. But here's where it gets controversial. Should app developers be allowed to market these as health solutions without any proof, or is this just the free market at work? How can you spot an app that's truly built on evidence, rather than slick sales tactics? For beginners dipping their toes into this, it's simpler than it seems. Look for telltale signs that scream legitimacy. Does the app reference actual scientific studies, perhaps linking to peer-reviewed papers from reputable journals? Was it crafted by real pros, like in partnership with a university, a licensed therapist, or a professional health group? Has it undergone independent testing, with results published in academic outlets? Does it handle your data responsibly, explaining storage practices and adhering to laws like HIPAA, which, by the way, is the US standard for protecting sensitive health information to prevent breaches? And crucially, does it steer clear of wild guarantees, such as instant sobriety or 100% success? These checks can help you sift the wheat from the chaff, ensuring you're investing time in something worthwhile. What's the state of regulation and enforcement in the world of app stores right now? Frankly, it's a wild west out there with barely any policing. Countless health claims from these apps go unchecked and unsupported, leaving millions exposed to false info that could sabotage recovery efforts for those battling substance use disorders. Think about it. Someone in a vulnerable spot turns to an app for hope, only to get bad advice. It's a recipe for setbacks. Now, turning to generative AI in these substance reduction apps, what worries experts the most? The explosion of generative AI has supercharged the market, pumping out tons of unvetted and experimental products at breakneck speed. Tools like ChatGPT show promise in democratizing access to health facts, potentially empowering users with quick, accurate insights. But, and this is the part most people miss, there are glaring risks. AI can spit out wrong medical details, mishandle urgent crises, like ignoring signs of overdose, or even downplay dangerous habits by framing them casually. For instance, if you're asking for quitting smoking tips and it suggests unproven hacks without warnings, that could lead to real harm. And here's a counterpoint to ponder. While AI speeds up innovation, does its unregulated rush prioritize tech hype over human lives? How can everyday users shield themselves from these dodgy health apps? Stay savvy by dodging apps that toss around buzzwords like clinically proven without backing it up with specifics or sources. Be wary of those offering quick-fix methods that sound miraculous, like a one-tap cure for addiction. If it seems too easy, it probably is. Instead, cross-check with trusted health sites or consult a professional before diving in. What steps could we take to beef up oversight for generative AI and health apps? A game-changing approach might be mandating approval from the Food and Drug Administration, FDA, similar to how drugs are vetted. This would require apps to pass rigorous randomized clinical trials and hit clear benchmarks of safety and efficacy before hitting the shelves. Imagine the peace of mind that could bring. In the meantime, straightforward labeling is essential. Apps should clearly state if they're evidence-based or experimental. Pair that with real teeth in enforcement, such as hefty fines, temporary bans, or outright removal of violators from stores, and would foster a landscape where mobile health tools are dependable, secure, and ethically sound. As we wrap up, what do you think? Should governments crack down harder on these apps, even if it slows innovation, or is personal responsibility enough? Have you encountered a shady health app yourself? Drop your thoughts in the comments. I'd love to hear if you agree or have a different take on balancing tech freedom with public safety. Source: Journal reference: Russell, A. M. et al., 2025. The Need for Oversight over Apps for Substance Use Reduction. JAMA. DOI: 10.1001 JAMA.2025.19143. https://jamanetwork.com/journals/JAMA/article-abstract/28405755